Hi Kim, how are you today?
I am great. How are you, Cassie?
I'm doing well. Good to see you. I just wanted to stop by and just kind of give you some information about, obviously it's stroke month and what we're able to do for that. So I know that you have a lot of patients that have suffered for a stroke or could be a potential risk for stroke, and Parkinson's as well, right? But this is a conversation that we can have. With our clinical pathways, we have lots of different things that we're able to do with those patients that maybe have had strokes, physical therapy, as well as medication monitoring. So there's lots of different opportunities that we have for those stroke patients, as well as maybe like checking vitals and seeing for her, hoping to negate any of those maybe precursors too, as well as, you know, the patient that's already had that, let's see if we can get them back in recovery.
Right.
Do you have any questions for me on things that we can do, or?
Do you give the patients anything once they go home with you guys?
We do, yeah. So
stroke?
for stroke, there's obviously, like I said, that medication management, but we also have the physical therapy, the occupational therapy. So if there's any sort of partial paralysis or things like that, we're able to help them to overcome, do their everyday activities for daily living, helping them with, you know, just the everyday monitoring of their medications, but also their living.
Of course. Yeah, with the medication comes, you know, making sure they're taking their medications. That's very important to us. So I'm sure you guys are monitoring their blood pressure. And,
absolutely.
Of course, yes.
And then, you know, of course, those are things that we're able to teach that teachable caregivers. So just kind of being a second set of eyes and ears in the home.
That would be great.
So that's some information on that. Do you have any patients that you can think of that might be?
Actually, Miss Rent just came in. She said she was feeling very dizzy and her blood pressure was through the roof.
Okay.
You think you can help us with that?
I do. I absolutely do. Yeah. If you give me her information, or get her on, and then what I will do is I bring back a report. We're able to do a report, so you can kind of monitor her progress.
Because she comes in all the time with the same stuff. So having you guys in the home would really help her not come into our office as often.
Absolutely. And what we'll do is we kind of like bridge the gap. So we'll reach out to her PCP if there's anything that we need to, outside of your concerns for her as well.
Perfect. That would be wonderful.
All right. Thanks, Ms. Kim.
Well, thanks, Cass.
You're
Take care.
welcome. I'm going to come and get that patient from you.
Yes.